Welcome, everybody. I'm Kim McKenzie. With me is Tess Greinock, and we're the Research Data and Scholarly Communications Librarians here at UMassChan. And today we're going to talk about Research Data Management 101, specifically the elements of data management and sharing plans. So something that anyone who runs a lab or will be running a lab or who is applying for funding from places such as the NIH should know about. So our learning objectives today will be to understand why data management and sharing is important, to learn some definitions behind the elements of an NIH data management and sharing plan. And finally, we'll practice the steps of drafting one of these plans in a tool called DMPTool, which Tess is going to introduce later. So let's start kind of with the big overarching question, which is why worry about managing your research data to begin with? And there are three very good reasons. It makes your life as a researcher easier, funders require it, and it's the right thing to do. So how does it make your life easier? Managing your data will keep you organized and more efficient. You'll be able to find your files when you need them. You'll avoid data loss because you'll know where you saved your files and what version they are. And you'll satisfy legal obligations, such as data management mandates that come with funding. And having clean and easily shareable data sets can lead to increased citations and credit for your work. And having that clean and organized data will make life easier for others, such as the grad student who may take over a project from you, or who tries to build on your data in the future. Second reason is that funders are now requiring data management and data management plans. So specifically for today's workshop, we're going to be talking a lot about the NIH, which has recently set a new policy that will become mandatory in January 2023, which requires a submission of a data management and sharing plan, as well as actual compliance with that submitted plan. Okay, there we go. And finally, it's the right thing to do. If your data are organized, well-documented, preserved, and accessible, the results are high-quality data that are easy to share, which can increase your citation rates and credibility, particularly in a time when reproducibility is a big issue. Reuse of data can also be a cost saver. Like, why pay to rerun an experiment that's already been done? So let's move on to talking more about data management plans specifically. But first, a very quick activity. I'd like you to take a look at this rather complicated look or picture of the research life cycle. And in the chat, type in when in this cycle you think a data management plan should be created. So we'll give just a minute for this.
I'm seeing a lot of proposal writing and planning in the chat.
Excellent. Yes. So for those of you who said that, excellent work. While data management is part of the entire research lifecycle, a data management plan should be drafted as you are planning and writing up that research proposal. And I've been saying data management plan over and over again. What actually is a data management plan? A DMP is a formal document that outlines what you'll do with your data during and after your research. It should be created before you start your research, as we just mentioned, and in many cases must be submitted when you are applying for funding. So the general components of a DMP include information about the data being collected, what standards for data and metadata are relevant, which we'll talk about in a little bit, as well as how you plan to share, reuse, or preserve your data. Since you're often submitting this along with requests for funding, budget needs could also be discussed. Well, this sounds like a lot, but there are tools to help, as well as librarians, meaning us in our department. And DMPTool is a resource that can help you create a plan with UMassChan specific guidance. It's something that we have access to as a school. And Tess will give you a demonstration later on to show you what that looks like. So going back to, the NIH, which is going to be our main focus, they are going to require specific elements for their data management plans. And so for the rest of the workshop, really, we're going to kind of focus in on those specific requirements. So first off, what does the NIH data management and sharing policy say? In general, the purpose of the policy is to make the results and outputs of NIH-funded research available to the public through effective and efficient data management and sharing practices. Why? Because data sharing enables researchers to rigorously test the validity of research findings, strengthen analyses through combined data sets, reuse hard-to-generate data, and explore new frontiers of discovery. The NIH encourages data management and sharing practices consistent with the FAIR data principles. And for those of you who haven't come across that term before, FAIR data sharing principles include making your data findable, accessible, interoperable, and reusable. Now, there's many components that go into this, and we're not going to cover specifically now making your data findable, accessible, interoperable, and reusable. But you can read more about the principles in the 2016 commentary linked here, and we'll be sending out these slides that first discuss the idea. So under the NIH policy, researchers are required to prospectively plan for how scientific data will be preserved and shared. So let's move a little deeper into the elements that are going to go into one of these NIH data management plans. Excuse me. These elements are discussed in full at this link. You'll notice these are at the bottom of the slides. But we're going to give you some of the highlights for each of these. And these 6 topics will need to be covered in an NIH data management plan. Data type, the related tools, software and code, standards, data preservation, access and timelines, access, distribution, and reuse considerations, and oversight of the data. Now, excuse me again, before we, the basic purpose of the data type section, first of all, is to describe the scientific data that is going to be managed, preserved, and shared. And before we jump into the details of what that means, let's take a quick look at the definition that the NIH provides for scientific data. They're referring to, this is quoted directly from them, the recorded factual material commonly accepted in the scientific community as of sufficient quality to validate and replicate research findings, regardless of whether the data are used to support scholarly publications. I find that, as you might, a little bit vague, but here's what they say scientific data is not. Lab notebooks, preliminary analyses, case report forms, paper drafts, peer reviews, communications that you've had with your collaborators, or physical objects that went into that data collection, like your specimens. So they're really talking about the data that is being collected that is supporting the work described in that grant proposal. You know, they mentioned whether or not it's used to support scholarly publications. You know, if it's being used to support the grant proposal that was submitted to the NIH, that is something they're going to consider scientific data. And in the data management plan, we'll want some details, such as the type and amount of data you're planning to collect. Is it fMRI data? You can put that in there. Genomic data, list that, and explain what the data will look like when you share it. Are you going to share individual results, aggregated results? How processed will that data be when you are sharing it? And what data is going to be preserved and shared? There could be a brief description of the metadata, which is the data about your data, which we'll come back to in a couple of minutes. And any associated documentation that could be shared along with it, like study protocols or consent forms, or if you run a survey, the survey would be made available. You might be thinking, this sounds like a lot. You have a lot of data that goes into your projects. It can be. The NIH, though, does not anticipate that all scientific data from a study will be preserved and shared. because specifically there are some legal and ethical considerations, particularly for human subjects data. So if you have data that includes personal health information, that's something that you will have to think about, whether you can de-identify that data before you share it, whether it can be de-identified, things like that. So those things are something that researchers should consider and then discuss within their data management plan. And you will be, the NIH will be looking for explanations for why you can or cannot share the data that you are collecting in whatever project you're talking about. Okay, let's take a minute for you to brainstorm. If you were writing up a data management plan for your work, what types of data would you be including? Just take a couple minutes and let us know in the chats. Yeah, survey data and interview data, that would absolutely be something you'd have to think about, making sure it was de-identified, that you couldn't tell what individual it came from, health records especially. Yeah, genome sequencing. Excellent. Okay. So next up in your data management plan should be a discussion of related tools, software, and code. So if someone wanted to use your data, reuse it, or even to open and take a look at your data, would any special programs or tools be needed? If you could share it in spreadsheet form, will it be stored in a format that's open, like a CSV file, or is it in an Excel file? It's a hint, CSVs, open formats are usually better when you're trying to share data. If you've written or used code to process your data, is that openly available? So this section really needs to explain what your data is going to look like when it's shared and whether or not it will be easy for others to make use of it. And so that can take a little bit of thought. So we're going to do again, take another minute and think about the tools that you use. Would your data be easily accessible, or would it be in a format that you need a special program or special tool in order to open? Go ahead and put that in the chat too, or just think about it, something to think about. And I'm now gonna stop sharing and hand this off to Tess. Exporting to CSV, yeah, that's good. Yeah. Okay.
All right, now that you've had a couple minutes to think about what tools that you use when handling your data, now we're going to move on to the next section, which is standards. And you will need to indicate what standards will be applied to the scientific data and associated metadata. So that's things like data formats, data dictionaries, data identifiers, definitions, unique identifiers, and other data documentation. And while many scientific fields have developed and adopted common data standards, others have not. And in such cases, you can indicate in the plan that no consensus data standards exist for the scientific data and metadata to be generated, preserved, and shared. So regardless of scientific field, the data formats that offer the best chance for long-term access are both non-proprietary and unencrypted and uncompressed. So these are file types such as MOV for video, WAV for audio files, and CSV for spreadsheets, which Kim already mentioned. Another part of this section is detailing how data will be documented, whether that is through metadata, a data dictionary, or a README file. And if you've never heard of metadata before, it's the information we create, store, and share to describe things, and it's often called data about data. And you'll find it throughout information systems like a library catalog. And it's structured to some degree, meaning that specific details are collected and stored, like the title, authors, description, etc. For example, for like a book in the library catalog. And here is an example of what metadata looks like for data. And this example comes from the Dryad repository. And the submission record displays the project study level information such as keywords, scientific names, abstract, and so on. And each data file is accompanied by a README text file, which explains what is in the data file and how the data was collected, etc. Comprehensive data documentation, or metadata, is a key to the future understanding of research data. Without a thorough description, it is unlikely that the data can be easily discovered, understood, or effectively used. So what details should be included in your metadata? So things that you want to include are specifics on the digital context, so the name of the data set, when it was last modified, and the software used. The investigator and stakeholders, so who collect the data and who to contact for questions. The scientific context, why data were collected, what data, and what instruments were used. The parameters of the data, so units of measure, and definition of codes used. And a good rule of thumb is to write your metadata for a user 20 years in the future. What will the investigator need to know? Prepare the data and documentation for a user who is unfamiliar with your project, methods, and observations. This is also known as the 20-year rule. Across most metadata standards, there are general fields that are shared, such as title, creator or author, description, format, etc. And if you're going to be developing your own metadata standard for your lab or project, these are some fields you might want to consider including. Chances are, though, that your scientific field already has a metadata standard or schema that you can use. So you don't need to create your own, and it'll make your data more interoperable with other data from your field. So to help find the standard for your discipline, there are 3 directories maintained by different groups. You have the Disciplinary Metadata Registry maintained by the Digital Curation Center, Metadata Standards Catalog maintained by the Research Data Alliance, and fairsharing.org, which is a registry of standards, databases, and policies. The repository where you want to deposit your data will also probably have their own metadata standard as well. So knowing what metadata the repository needs at the beginning of your project will allow you to collect the metadata needed as you complete the project, making data sharing so much easier. An example of a metadata standard that many UMassChan researchers are familiar with is the minimum information about a microarray experiment, or MIAME, which is used by GEO, the Gene Expression Omnibus. And just as there are a number of standards available to help determine the metadata fields that should be included, there is software and a number of other digital tools that can be employed to create and manage metadata content. There are specialized tools such as the DataCite Metadata Generator, which is a single HTML form which can be used to generate DataCite metadata in an XML form. And some of the specialized software is being developed right here at UMassChan, such as Omega and the MicroMeta app from Dr. Strambio de Castilla's lab, and DMeta from the Dolphin suite created by the Bioinformatics Core for genomics and transcriptomics. You might also find the right tool for you on this index of metadata tools from the Digital Curation Center in the UK. And keep in mind that automatic metadata is also generated from a number of tools such as microscopes, cameras, and other instruments. Where no formal metadata standard exists, or you're looking for a low-tech tool for recording metadata, writing README-style metadata in a text file is an appropriate strategy at the very least for internal use. This slide shows the beginning of a README text-style metadata file, and you can find a similar template and examples on the resources guide linked from this page. The template opens up a text file that you can download to your computer and fill in. A data dictionary is another metadata collection tool which represents the structure of your data set. Each row in a data dictionary, which is generally a spreadsheet, corresponds to a field in your data entry form and provides a detailed description of each variable, such as variable name, meaning, units, and format, permissible values or range of values, known issues with the data, such as like systematic errors, missing values, etc., relationships with other variables, and null value indicators, and anything else someone needs to know to better understand the data. In other words, the types of things you would want to know when faced with an unknown data set. Not only is it such information incredibly useful if you're sharing a data set, but it's also useful if you plan to reuse a data set in the future, or you're working with a very large data set. Basically, if there's a chance you won't remember the details or never knew them in the first place, a data dictionary is needed. And some research data collection tools, such as REDCap, generate a data dictionary for you based on your data collection forms so that you can reconstruct your database fields if you need to. Note that a data tree does not include the actual data you've collected. Another data standard that's increasingly mentioned in funding opportunities is Common Data Elements, or CDEs. These are standardized fields, questions paired with a set of specific allowable responses, which can be used across different studies to ensure consistent data collection. They're both human and machine readable and can be a single element such as blood pressure, height, etc., or a group of elements such as a survey instrument, such as a quality of life scale. And overall, CDEs facilitate reproducible research and metadata analysis. You can search for CDEs in the NIH CDE repository. You can also browse by CDEs by the NIH agency or center. And this is particularly useful if you are applying for a grant for one of these centers and they ask you to use their CDEs. And another cool feature about the NIH CDEs is that they can be imported directly into REDCap. And so this is going to save you a lot of time creating those questions because they are already available in the catalog by using the import from field bank. The next section of the data management and sharing plan is data preservation, access, and associated timelines, which includes the repositories where you will archive your data, how the data will be findable and identifiable, so what persistent unique identifiers will be used, such as a DOI, or where the data will be indexed by the repository, and when other users will be able to access the data and for how long. The timelines for release may be different for subsets of the data, which you would describe here as well. So how do you choose which repository to deposit your data in? If your discipline has a specific data repository, we always recommend looking into depositing your data there first because the repository will be better aligned with your data and other potential users will be more likely to find it there. If your discipline does not have a specific data repository, check to see if the journal you would like to publish in or your funder has any repository recommendations. Your institution or your collaborator's institution might also have an institutional data repository that will accept your data. You can also find a number of subject data repositories and generalist repositories by searching these two registries, re3data.org and fairsharing.org. So when I say disciplinary repositories, some examples of these are ICPSR for social research, Gene Expression Omnibus for genomics, NCBI GenBank as well for genomics, Dryad, and Data One. And some generalist repositories are repositories like Dataverse, Zenodo, GitHub, and Figshare. And here at UMassChan, we can accept datasets into our online repository, eScholarship at UMassChan. If you'd like to include eScholarship in your data management and sharing plan, we have language that you can use in your data deposit policy. So let's pause for a few minutes to give you an opportunity to explore the repositories listed in re3data or fairsharing.org, and I'm going to put links to those in the chat. And I'm going to give you a few minutes to see if you can find a data repository for your discipline where you might deposit your research data. And once you found a repository, please feel free to add it to the chat.
Yes, the substance abuse and mental health data archive would be a great one for any sort of mental health or survey type data or personal health, not personal health data. That's not what I was trying to say, but yes. Good job.
Yeah, and I see ICPSR in the chat, and I didn't mention this for the disciplinary repositories, but UMassChan is a member of ICPSR, so we do get special privileges through them as well. All right, so feel free to keep adding those repositories in as you find them. I'm going to move forward with our next section, or continue with the same section, but move into the timeline for sharing. And when it comes to the timeline, the NIH wants scientific data funded by them shared as soon as possible, no later than associate publication or the end of the performance period, whichever comes first. Some awards might have more specific guidance. Journal data and sharing policies may also dictate when data should be shared. Quite often, they require that data is shared for peer review or at the time of publication. And I've linked to some examples of data policies on this slide. Something to keep in mind when looking at repositories is that some will allow you to embargo data from public sharing as well. So if that's something that you're looking for in a repository, that is something that I would include in my repository search as well. So there may be several factors that determine the amount of data access, distribution, reuse, and distribution and reuse. And a section of the data management sharing plan is devoted to these considerations, including limits on data sharing based on the informed consent provided by the participant. So make sure that all your consent forms allow for appropriate data sharing. What measures will be taken to protect the privacy and confidentiality of participants? So de-identification measures, etc. And will any controls be put in place to access scientific data derived from humans, such as will future data users need approval from the repository to access the data? And are there any restrictions to data such as HIPAA, the Health Insurance Portability and Accountability Act, or data use agreements that you may have signed or need to sign to use data for research? Oversight of data management sharing is the final section of the NIH Data Management and Sharing Plan. It covers how is the plan going to be monitored and who is going to ensure that the plan is followed and how often they will check. Keep in mind that plans do and will change, and what you provide as part of your grant proposals can be updated if needed. For example, perhaps if your data manager that you thought was great leaves to start a bakery. So to help you create data management plans, include the new NIH Data Management Sharing Plan, UMassChan has access to DMPTool. So this is the portion where I'm going to move into a demo of DMPTool itself. You are welcome to follow along and ask questions as we go through the demo. So I'm going to escape. So the first thing you'll need to do is go to dmptool.org. And once you are there, you're going to click on the Get Started button. And since UMassChan is the subscriber, you can log in using your UMassChan email and password. If you're not affiliated with UMassChan or you leave UMassChan to another institution who's not affiliated, you can create an account for free as well. But I'm going to go ahead and use the UMassChan login. So I'm going to type in UMassChan, and it'll bring us up right away. Go. And then you'll need to log in with your UMass username and password. And it will bring you to your dashboard. Now, the first time that you log in, you're not going to have a full list of all these data management plans. So you're going to want to create your first plan. You're going to click on the Create Plan button. I'm going to go ahead and create a plan. And within this plan here, you're going to give it a name. So I'm just going to use testing DMSP template, and this is the second one I'm creating. And if you want to just test it out for today, feel free to go ahead and indicate that it's just a mock project for testing, practice, and educational purposes with this checkbox right here. It is already, if you logged in using your UMassChan affiliation, it's already selected UMassChan as the organization. And then since we're interested in the NIH Data Management Sharing Plan, where you can search NIH, it brings it right up. And then it asks us which of their templates that we would like to use. They already have the forthcoming plan in their as a template in their system. They actually just added it this Monday, so it's brand new. And I'm going to go ahead and create that plan. And this is the first page is where you're going to enter your project details. So a little bit of an abstract, domain, start and end date, and a little bit more about the funding. You can also add collaborators to your draft plan that you're creating, and you can provide them different levels of access so that you can all be writing it on it, or if you just want to share it for viewing for educational purposes, you can do that from here. The Write Plan tab is where you'll enter the information needed for the plan itself. And the great part about using DMPTool is that they've broken it down into the sections that you need, and they provide helpful instructions on what you need to put into each section. So the instructions are both before the text boxes, as well as below them. And then you have further guidance on the right-hand side in these different tabs. So they've collected guidance from the NIH, as well as DMPTool has created various guidance for data management plans in general, which you can access in the DMPTool tab, and then click down to see a general guidance from them. You'll also see a UMassChan tab for some of the areas as well. And this is where you can find guidance directly from us. And so these are going to be various links, as well as information of if you're depositing your material in eScholarship at UMassChan. This is where you're going to find it as well. And we are going to be adding more guidance in the coming months as well as we prepare for the launch of this new policy. Also within DMPTool, you can request feedback on your data management plan. And this request will be sent to our team here at the Lamar Studio Library, and we will respond to your request within 48 hours. So if you just want another set of eyes to look over your data management and sharing plan, we are here for you. And once you are done, finished your plan, you can download it to include with your grant, as well as if you would like, you can publish it on DMPTool, either within UMassChan or for the public, or you can just keep it private just for you and your team and anyone you've shared with. All right, so I'm going to go back to the slides. So there is work involved in data management and writing a data management plan. So it's important to remember why we do it in the first place. We need to check some boxes, such as funder and publisher requirements, and being able to respond to Freedom of Information Act requests. But more importantly, data sharing increases the impact and visibility of research, provides credit to the researcher as a research output in its own right, which is especially important for new researchers who are developing the research record, and enables new scientific collaborations, reduces duplication of effort, and maximizes transparency, accountability, and reproducibility of research findings. For more information about the NIH data management and sharing policy, the NIH recently started an FAQ page, which will be growing in the coming months as well, I suspect. For more on research data management in general, we created a resources guide for UMassChan, which contains both general and local resources for research data management. And as Kim mentioned earlier, data management costs money, and you can write data management costs into your grant proposals. The National Academies of Sciences, Engineering, and Medicine were tasked by the NIH to develop guidance on costs, which is available as a report linked on this slide as well. Today's seminar is part of the library seminar series for researchers, and we have more data seminars coming up. Our next one is going to be cleaning data using OpenRefine on April 6th from 1 to 2. And then we'll be having a finding data seminar on June 8th from 1 to 2. And then a series of 3 data visualization workshops in July covering data visualization in Excel, R, and Python. So stay tuned for more information. This week is also International Love Data Week, and we are running a couple of fun activities. Check out the hashtag LoveData22 for events and discussions happening throughout the week. And this year, the age-old question of whether data is or data are is being put to the test. We have used it interchangeably throughout this presentation, but do you believe the statement should read data is awesome or data are awesome? All the data collected will be aggregated and shared by ICPSR at the end of the week. We're also encouraging UMassChan to get creative with your data. Use your creativity to showcase your favorite data in a unique way, like this Girl Scout cookie pie chart. Tag us in your tweets or Instagram posts, and we'll share your work on our social media feed. Get those creative juices flowing. So we've come to the end of our presentation, and we would love to hear how we did. So if you could take a moment to fill out this 2-question survey, that would be greatly appreciated. The 2 questions are, what is one thing you enjoyed or learned during the session? And what is one thing in the session that could be improved or a question you still have? And any questions asked through the form will be sent as a response to everyone registered for the seminar when we send out the slides for the recording. Thank you, and here is our contact information. And if you forget everything today and only need to remember one thing, if you have a question, look for the Ask a Librarian button on the library website. Thank you very much, and we're happy to take any questions now.